Hi. Hello, everyone. This is Dr. Janice Makela. We're just about starting here with our live stream. Let me just get one little thing here straightened up just to make sure that it's working. I've been having some technical issues right before then, so we just want to make sure. And I'm gonna start soon. Waiting for host to start. Is there that much of a lag? There you go. Hmm. Oh, thanks, Santana. Oh, yeah. So there's a bit of a lag actually. So hopefully you guys are being able to enjoy it. Let me know if you can't get any texts or if you can't get any comments in here. Okay. So welcome. I'm Dr. Janice Makela. I am a hospice doctor and a geriatric doctor with over 20 years experience. I have been working in geriatric medicine again, for 20 years in all sorts of settings. I've taught geriatrics. I have worked in nursing homes. I've worked in hospices. And in that time, especially in my hospice and palliative care world, I have seen a number of people need and benefit from cannabis, and I've become a cannabis expert. So I am here today to to answer your questions. Um, put them in the comments. Let me know what you think. Now, I recently have come back to my Q&As after a little bit of a break because I had a couple conferences. Last week, I was at I was actually in CanMed last week in Puerto Rico. And then the week before that, I was in Benzinga. These were sort of back-to-back conferences. I did a little bit of a check-in from Puerto Rico, but I didn't really announce it, so I'm not sure how many people actually saw that. Anyway, I had Benzinga was really interesting because it was business, right? It's a business of medicine, of cannabis medicine. It's the business of all that. And so a lot of CEOs, a lot of investors, a lot of people talking about the market and what's going to happen in the cannabis world. It was very interesting. Um, really saw some interesting things, including some people who were working on developing full spectrum CBD for pharmaceutical market. Um, that was kind of interesting. And then we had CanMed, and that was a little bit more of the medical, the doctors, the nurses, scientists, um, the growers and the geneticists. I actually got to talk to a lot of different interesting people, including the guy who um, actually completed and identified the genome of uh, of the cannabis plant. And I've talked to several of the leading experts in cannabis about a variety of different things. And of course, attended many sessions and learned a lot. So it's been a bit of a whirlwind, but it was fun. And I hope everyone here, benefits from that. But yeah, so now we're back to our regular scheduled Wednesdays. I wanted to ask a little bit, is this a good time for people? When we talk about sort of these podcast type things, a lot of times the live stream, they say, do it during business hours because that's when people are going to be on LinkedIn. That's when people are going to be checking stuff. When they get home, they're going to get busy and stuff like that. But cannabis is not a safe for work topic for everyone. Some people probably can't be watching this. And plus, if you're working, you're kind of busy. You probably don't have an hour to spend with me in the afternoon at 3, well, Central Time. And, so that's 4 Eastern and like 1 Pacific, if I remember right. And so that may not be a great time for some people. So I would love some insight from people if they think that they'd be more able to watch this live if I did it in the evening hours, say 7 Central or something like that, where people would be able to watch it not too late for one and not too early for the others, right? The we could change that time and see if that helps people be more available. I am, what else about that? Yeah, so let me know, comment. I actually have a survey in LinkedIn, um, but otherwise you can also just put it in the comments if you think that there's something that would be better. Now, that's some of the housekeeping. It's great to be back. It's great to see everyone. I again, this is a interactive Q&A. You guys are the co-stars. Um, you put your questions, I see them, we interact off of the comments. That's how it sort of works best. So I look forward to any questions or comments you guys might have. Go ahead, throw them in the chat, and we'll talk about that. Meanwhile, I will talk a little bit about something that's not normal for me because I'm a geriatrician, hospice. I'm way on the other end of pediatrics. I got so far away from pediatrics, I study people over 65 and people at the end of life. Pediatrics is something completely different for me, but it's important when we talk about it with cannabis, because there's some few different things. First, there are situations, there are people who need it in the pediatric age group with their doctor, with their healthcare team. There are certain conditions, certain types of epilepsy in the pediatric age group where cannabis helps. They now have the Epidiolex, of course, the high dose CBD that's FDA approved. But a lot of people are also using sort of full spectrum CBD or some other similar low THC, very high CBD medication to help with seizures, particularly in people who have these intractable seizures, fancy word for meaning they don't go away. You try 5 different medicines and they still continue to have seizures. There's a lot of developmental disabilities that people can be born with, genetic disabilities that make you prone to this. And some of these seizures are extremely hard to treat. And so there are a lot of people who use them for their children with that, in conjunction with their doctor, their neurologist, and all them helping them. There are also some evidence. I know the group that was looking at their full extract CBD with a little THC in it was actually looking for this indication that autism might help with behaviors. And again, these are severe behaviors. These are children who are self-destructive or harming other people. Um, Not just a little outburst or outcry. It's really severe behaviors where they say, you know what, a little bit of cannabis might be helpful and that might be very useful. Now, that's one reason in pediatrics you might see it. But the other thing is then you hear about teenagers using it. Now, I got 2 teens myself, all right? So a little near and dear to my heart. And especially as I talk about this regularly, I talk to them about that, right? And I want to make it clear a few things. Medical is one thing, right? When we need it medically. When we're talking about in the teenage group, when we're talking about recreational, there's actually been some studies that kids actually are drinking less, but they're using more pot. And it's like, mm, the problem is this. There is this brain development that happens. And we've talked before how in Alzheimer's, cannabis can actually help certain things protect neurons, actually even help develop new neurons with that. But what we see is that there's a certain age group in the late teens, early 20s, where the brain is going through this function that we call pruning and myelination. It's the fancy terms for it. What that is it's basically two things. When we talk about white matter in your brain, um, it's developing more white matter. It's putting fat on these neurons so they work more effectively. And then it's kind of chipping away at some of those neurons from childhood that you don't need anymore. So, uh, excuse me, sneezing. So, these neurons from childhood that you don't need anymore, right? You know how kids kind of forget things that they knew when they were little. All those little neurons, they get pruned away during this time period because you don't need them anymore. Well, that kind of makes things a little bit more um, adult, right? You go from being at the start of this process, say around 14, to the end of the process, which is often as late as 25. And that process is dictated by the endocannabinoid system. Your own body's natural cannabinoids are making this process work. And it's debated. There's people who have different opinions. I myself hold to the view that probably what's happening is that there are some people who genetically are prone to that process not being great. And we see that, in the late teens, early 20s, schizophrenia starts to show up naturally, about 1% of the population. And it's suspected that probably something in that processing messes up that creates schizophrenia. So, again, a genetic tendency for that process to not work right. Now, there are some people who say that, listen, the only people who get cannabis psychosis, so these kids who smoke it and then they get really psychotic to the point that they need to go into the inpatient unit of a psych ward and get treated, that those kids are only kids who would have probably gotten schizophrenia anyway. Mm, maybe. And by the way, hi Lance, nice to see you. I'm and so these kids here, they would have gotten schizophrenia anyway. Now, that's one theory. I personally, and this is kind of where I hold on it, think that the development at that stage is sort of a range. So you have perfectly normal, then you got a little bit less than normal, then you got a little normal, then you got someone who they're not schizophrenic, but they're not normal. You're like, something's got, they're maybe have some schizophrenic types traits, but never get fully psychotic. And then you get people who are outright schizophrenic. So you have a whole range as that process develops. And I personally think that cannabis during this time period kinda adds an extra hit to it, and maybe someone who might have been in the low normal range now gets pushed into the symptomatic range. That's why it doesn't affect everyone. Some people might be very, very normal, and they're not affected by it, but then some people are, and it's kind of Russian roulette with your brain at that age. And so the message I often give kids and my own kids, right? Is that we're not trying to bogart the good stuff from you. This isn't us saying, wait till you're an adult. And it's like, well, I am an adult. I feel like an adult. I'm going to have some cannabis. No, no, it's dangerous at this point. That's the point. At this time period, your brain is changing and cannabis F's that up. Pardon the but it does, it messes that up. And so it makes you more prone to bad things happening, and we don't have a good way of knowing who those people are, who bad things are gonna happen. Obviously, if you have, like, a family history of a first-degree relative with schizophrenia, you should probably not do cannabis, period. But anyone else, we really don't know who's gonna get prone to that. So I that's why I tell people, teens and stuff, you gotta wait until your mid-20s. We say 21 legally, but some people would probably be better even waiting into their, until 25 when that process is completely over. Now, and again, I know a lot of people my age and stuff, "Well, I did it when I actually didn't, but I have friends, who did when they were teens. Cannabis was a little bit weaker, it was a little bit different, and again, it's kind of this Russian roulette. Some people are gonna get, it, some people aren't. So, that's why we tell kids this. So, that's kind of the message I have for kids. It's not bad, it's not war on drugs, it's not, "Ooh, you're a bad person." It's yeah. Now, onto some questions. Lance actually asked, he said, "Does he smokes a bowl helps calm his tremors." Does that make sense? It makes perfect sense, actually. Um, there is some evidence that tremors might respond well to the cannabis, especially if someone like, obviously, if someone has some dopamine deficiencies, such as Parkinson's, it can help. But even essential tremors, some people do respond to cannabis. Kids and CBD, you know what? That's a completely different thing. Again, so what we see with kids and CBD, so there are CBD seems to have kind of the opposite effect in a pro thing. So there are some studies in people at high risk with schizophrenia, and actually what they gave them was omega-3 fish oil, right? And so fish oil actually helped prevent some of the schizophrenia symptoms in people who are very high risk because they had like both parents were born with schizophrenia and now they were there and they were maybe already starting to exhibit some stuff. So their doctors in the study gave them fish oil and it actually prevented a number of them from getting psychosis and getting a florid schizophrenia, which I found really fascinating. The other thing is that there are some studies about CBD in people who have actual schizophrenia. There was one where they compared it head to head against an antipsychotic and showed that the CBD worked better with less side effects. Now, am I encouraging people to just randomly throw out their antipsychotics and take CBD? No, don't do that. Talk to your doctor, get some good advice first before you do that. But it's promising. Again, it suggests that CBD might actually modulate it in a more positive way. So if kids are just doing CBD or these kids who are using it full spectrum CBD with just a little whiff of THC, they're probably okay. We're not seeing studies showing that these kids are getting psychosis. Now, that said, I talked to someone who was doing one of those studies. I asked him, and he said, well, obviously at people high risk, like, again, parents with schizophrenia or something, they've removed from the study. So there is a little bit of a caution there that they still don't want to do that. But generally speaking, CBD is going to be a little bit safer. Now, the tricky thing with CBD is you have to be sure that it's safe, right? You just get it from some gas station and God knows what it might be spiked with. You have to, I myself have been a big advocate of the hemp products, the CBD, the THC hemp and all those THCA and whatnot to make sure that if we have them, that they're legal, but they also are very measured and monitored and tested because there were some studies to show that a lot of these products weren't necessarily done with the best QA. And so as a result, you had people, when they've done some surveys, they found some with heavy metals, or like one case, one was in like one survey in the Northeast of 40 that they looked at, one even had mushrooms in it. So you have to be careful to make sure that if they're getting it, they're getting it from a source that tests their stuff and can show you their testing results and say, yes, this has been tested for metals, it's been tested for impurities, and it's safe to use. So, yes, but that's kind of what we do with this. That's the CBD. It is probably safer than THC, but again, you got to be careful because if you don't know what's coming from it. Uh, Mm. I wouldn't suggest hemp-derived THC unless it's a trusted source. 100%. 100%. Because what happens is there's really 2 ways you can make hemp-derived, THC right now, and hemp-derived, then there's delta 8, which is a slightly different creature. It's a shame because I think it does delta 8 does act as a cannabis light. It has less of an impact, it has less, but it's very messy. And here's the problem. There are 2 ways of making things. One is you can technically 3, but no one does the 3rd one. It's too expensive. The first one that you often hear of and what you talk about, unless it's a trusted source, is that people will take CBD, because we've got a ton of it everywhere, and they'll do some chemical reactions with it. They'll add a little this, add a little that, and then chemically convert it to THC. They don't do that much for THC as much, though if the Farm Bill changes and THCA is changed, you might start seeing that. That is how Delta 8 is made, though. Um, Delta 8 and regular THC are a little bit different because Delta 8 has a double bond on carbon number 8, whereas Delta 9, which is the regular THC, has a double carbon bond at the number 9 carbon, which is why it's Delta 8 versus Delta 9. So that's the only difference, but that one difference affects how it binds. So delta 8 doesn't bind as strongly at the CB1 receptor. Now, what happens though is when you do these chemical reactions, you get a lot of side things that pop up. Not only do you get delta 8 or delta 9, you get delta 10, delta 11, you get different isomers. So if you talk about like handedness, chemicals have handedness. So my one hand versus my other hand, right? And so you can have one that is left hand, one that's right hand. And so you get that differently. So a chemical can also be handed. So sometimes you'll see drugs like the ones we use for Parkinson's, levodopa, anything. There's a whole bunch of drugs called levo something something something, you know, and that levo means left. That's the handedness of that chemical. The right-handed chemical in those cases doesn't work. It doesn't bind to the receptor. So the handedness of the receptors can make a difference. So the point is what happens is the TH is that the in addition to making the THC or the delta 8, you get all these other chemicals that get made, whether it's the other handedness or a different isomer where that double bond is at the 10th or 11th or 8th or and so all of these different chemicals can pop up. Now when you do that, it can be hard. Lot of the tests that they use for just plant-based THC aren't testing for this. You actually need some more advanced tests to test for that. Now the good people actually do test for it, right? But then there's people who don't. And that is the problem because we don't know really what those isomers do. Now, interestingly enough, dronabinol, which is the fully synthetic THC that's FDA approved, does in their data show that it has some um, some of these products. When I tried looking it up, it was all redacted from public stuff. I'm sure if I really did like a Freedom of Information Act and looked it up, I could probably find it. But so we do know that there is like a safe level because these things do show up in dronabinol and it's been tested for the FDA. But we don't even sometimes know what those levels are that are being made. So that's the problem with the hemp derived stuff. Now, again, a lot of people will filter it, will do the testing, will do it right. And so that's why you have a trusted source. You say, how do you make your THC stuff? Now, a lot of people right now, what they're doing is, as you probably know, THCA is a non-psychoactive, very mild. It often gets used for nausea. A lot of doctors I know who have been doing this in the field for a while will actually prescribe THCA tea. They'll take the tea and then they'll just make some, and then the THC extract with a trace of THC pops up. THCA is almost never pure. It's always going to have a little trace of THC in it. Is for someone who needs their nausea treated but doesn't have a lot of tolerance to THC, will often do well with the THCAT. Now, the Farm Bill only said THC, but anyone who's ever grown the plant knows that the plant is actually THCA and CBDA. It's the acidic version of this. So there's a little acid connected to it. Not acid like acid, right? Not LSD acid. I mean, it is chemically, there's a little bit of an acid at the end of it. I think it's a little OH or something. But what that does is it changes it chemically, changes how it is. And so when you heat it up or burn it or bake it in brownies, that is um that is what makes it really high. That's what makes you know, makes it into THC. So the fancy term for that is decarboxylates. Cannabis is a psychoactive plant as a whole. THC is non-intoxicating but still psychoactive, right? So that's it. THCA again can get people a little bit buzzed, and there's even some thought that it might be the THC that's broken down into it that's doing it. But it is a lot easier tolerated by people who have than people who have trouble taking like a full THC. So you might be able to get away with like if you can't get THCA, decarboxylation. Did I say it wrong? Thank you for correcting it. So, mm, so the decarboxylation makes it into THC. So what you do is these hemp makers will take THC and they'll get a brand of hemp that when they test the plant itself, it's less than 0.03% THC, and say, look, it's hemp. It doesn't have much, but it's full of THCA. And that THCA, you just got to process it very minimally by heating it up, and it becomes THC. Now they just can extract that THC from there and they have THC, and now they call that hemp-derived THC, from 0.03%. And what's even funnier is that because it's by weight, and you're talking molecules, right? And so when like a brownie or a gummy compared to just a little drop in a few molecules or whatever, by weight, um, until by weight, right? That then is still less than 0.3%, and people are like, "See? It's still within the legal guidelines." We can debate the legality of that interpretation, if you want. I personally am of the view of where there's a law, there's a loophole. Cannabis itself is already on a bit of a loophole, so I'm not gonna begrudge, someone if they do it well, and I have seen people who do it well, um but you have to you have to know who you're getting it from. That's kind of how it goes. Personally, again, I would like to see legal hemp products because a lot of times when they try to make laws that make it illegal, they end up throwing out the CBD, throwing out the THCV, all of these other beneficial cannabinoids get thrown out. And because they're not that intoxicating, the dispensaries don't sell them. There's not that much demand for them. Why would anyone go through all the trouble and stuff of going to a dispensary to get something non-intoxicating? And at least that's what their thought is. And so they don't make them as much. And so a lot of people who need these cannabinoids and the CBD, California, there's a huge thing right now where there are people who were getting cannabinoids for seizures for their pediatric cases and now can't get them, and that's not right. So these kind of big swash rules are gonna be really, um, hurting. THC is non-intoxicating until there's some level of heat exposure. Exactly right. Yeah, that's right. And so that's it. THCA, and again, some people do get a little buzzed, I've heard, but it's probably because, when you make it into a tea or even just sitting around, it can still get that problem. Now, as far as what are some of your favorite ways to integrate cannabis if you're new to the practice? You know, personally, huh? I'll get you, Lance. That's a great question. Um, personally, I I actually suggest gummies. I mean, I would say either gummies or a tincture. And it depends what you're using it for. I had a friend at church who I brought her some gummies because she was getting chemo, but then the flavor of the gummies made her more nauseous when she was getting her chemo. So then I got her a tincture. And the advantage of the tincture is you can put it under your tongue and you can hold it under your tongue, and some of it can absorb much faster. So within 20 minutes, she was already feeling better. So if I'm using it medically, I actually prefer a tincture. If you're using it recreational, you want to be a little bit careful, of course, don't use too much. Or some of my older patients who maybe I want enough to let them sleep overnight, where I do want that longer acting of the edible, because an edible is going to, stay, especially in an older person's system, sometimes 6, 8, 12 hours. So you would tell them to take a little low dose, and especially if you're talking about sleep, that's going to be in their system, and that's okay. I would say a if you're looking for immediate reaction. Now there are some rapid acting because of the nano encapsulation and some of the new tech out there. Some of the um, some of the gummies are more rapid acting, but there's also the tinctures can be fairly rapid acting, as I mentioned. So if you're looking for immediate relief, I would suggest a tincture. Um, yeah, as a doctor, would really endorse smoking. Just something I can't do. Now, there are some people, they talk about vaporizing, where you take, a vaporizer, and it's dry plant vaporizing, where you take the plant whole or crumbled, and then what you do is you heat it up, not to the point it burns, just to the point that all the volatile chemicals come out, and then you can breathe it. There's a really expensive one called the Volcano, where you have a big bag, and then you can inhale from the bag. It's kinda interesting, but now they're working on some handheld ones. I know there's one from Israel, and not surprising, but maybe so. Philip Morris, I think it was Philip Morris, it could be the other one, actually bought the rights to it and plan to bring it to United States the minute it's legal. Smart move, but, yeah. The, now vaping, I don't like. I almost like the smoked rather than vaping, only because I got a little bit scared by the whole popcorn lung. I understand it was the vitamin E, but it just kinda shows you that the things you can add to the vape can be really bad. If you don't know that story, people got really severe lung disease from vaping cannabis, and they like critically ill, bad lung disease called popcorn lung, is the colloquial term. And they found out it was because people were adding vitamin E to the vaping solution to be healthy, except for that vitamin E, when burned, killed your lungs. So I'm not a big fan of vapes. I'd almost suggest if people had to pick, I'd almost suggest they smoke, but as a doctor, I can't say that. But then there is, so edibles is probably my favorite way, or tinctures. Uh, Now, Lance here actually asked a good question, and I know this is actually Lance and I have talked, and this is actually a passion of his. And I personally love that idea. He says, "Do you support Braille labeling for all commercially produced cannabis?" Yeah. I mean, what if you buy more than one product? How are you going to tell it apart if you don't have it on Braille, right? If so, yeah, that is that is definitely a thing I think that's really important because you want to be inclusive. You want people who are who have poor vision to be able to read the cannabis labels and be able to use them without, saying, "Okay, this is my 5 and this is my 10, milligram." You want people to be able to tell those apart. So, without someone having to ask, right? Now, Charmaine, let's see. Smoking is tricky with what we know about carcinogens. Exactly. And that's why as a doctor, I just support smoking. It's not the healthiest way. Now, one thing I run into is when I did my geriatric practice, I had a lot of patients who were like, "But doc, I can't afford the gummies because I don't know about the state you're in Illinois. A lot of things from the dispensary are really expensive. And when I worked in the city, especially, people don't have the money for this. In fact, one of the things that scared me the most is people will get it from the street because they can't afford um, the stuff from the dispensaries. One of the many reasons I would like to see things a little bit more legal so that there's a little bit of more parity in price, so people can find it more, cheaper. Because some years ago, I actually had two patients in hospice when I was working in hospice. Now, hospice patients shouldn't be hospitalized. That's kind of the whole idea, right? End of life. But we do have an inpatient unit for people who have severe symptoms. I had in 1 year two separate patients who had the exact same presentation. They were already smoking cannabis, and at the end of life, I'm like, okay." So they were already smoking cannabis, and I think they may have even been doing it recreationally before hospice. And both of them presented with a psychosis. And psychosis is really kind of a strong word. It is a more of bad, like hallucinations, right? They were completely out of it. At 2.5 days to the day, to the hour, both of them just kind of woke up and were like, "What the heck happened?" You know? And so there was this whole thing about, you know, and I tested them and they only showed up positive for cannabis. So I am convinced that their street cannabis was spiked because now the street guys are getting pressure from the dispensary guys. So they have to cut their stuff so that they can make money, right? And then they can sell it cheaper because they have cheaper stuff. And that's bad for people, which is why I'm very much for as much access as possible to safe and legal stuff. Now, as far as the carcinogens, yeah, not not great, and I see some people here. Someone said smoking, but we have one. Most vapes are made, or at least for a while, were made with distillate, which I'm not a fan. Exactly. Again, vapes kind of come out easy, but they're really not my favorite. And that's why I say if I had to pick between smoking and vape, I would almost take smoking. Again, not a fan. I would rather do the dry vaporizing. Um, but what's doubtful? I'll have to find that out. But I was gonna say, cannabis actually has less carcinogens than tobacco. I'm not sure really when it comes to smoking it, if it has less carcinogens. I think what is true though is that when I have smokers, they are smoking a pack or 2 packs a day. That's 20 cigarettes in a pack. If some are doing a half pack, that's 10 cigarettes, 20 cigarettes. When people are smoking a joint, there's some are only taking a puff a day, and even the heavier smokers are taking a joint a day, maybe two. So there's less carcinogens in just that joint amount compared to 20 to 40 to cigarettes. So that's kind of my take on that. That the question about the carcinogens versus the non-carcinogens in there. And so that's why I personally think um you don't see as much, when they've done some data about the effect on respiratory. Interestingly enough, by the way, CBD seems to actually have some positive effects. There are some people studying CBD and inhaling it in people with pulmonary hypertension and a lot of different really bad lung diseases. Again, CBD might be useful for that. Now, when they've done studies on THC versus, long-term use and stuff like that and its effect on the lungs, they haven't seen a lot of lung cancer pop up like they do with smoking. Again, I think that's just the amount of smoking, right, that people are doing, versus tobacco. And then the other thing is they're not actually seeing a strong association with full-on COPD, but they are seeing bronchitis, which is kind of like COPD light. COPD is defined by having certain degree of severity of bronchitis or emphysema at a certain point of it where I do a breathing test and you now meet this threshold, you have COPD. Before you have that threshold, you just have bronchitis or emphysema. And so there does seem to be an association with bronchitis where people kind of get a thickened breathing, your bronchioles get a little thickened and mucus filled when people chronically smoke. So it's not entirely benign. We do know it can cause stuff. I suspect part of the reason we don't see as much as we do with tobacco is just simply people don't smoke as many joints in a day as they do cigarettes. Mm. And yeah, it's very possibly, there's some carcinogens, right? Yeah, Charmaine, I know Lance actually, that is one of his passions, and he actually makes a brand of labels. So, being vision impaired himself, he makes a brand of labels for different producers of cannabis so that they can put it on their stuff. If you want to talk with him, go ahead, reach out. I'm sure you guys, the two of you, could have a great conversation. The effective newsletter. Okay. Now I know that's I know it's still not showing up on your name's still not showing up, William, on there. But giving my lungs life. Oh, I will have to look at that at some point. Can you tell us a little bit, like a sentence or two about what that says? What was its thing? What was its benefit? Again, there's even some data. There's starting to come out some question that even the vaporized may not be as good. Oh, best. Oh, hey, Lance, you just put your whole phone number up there. I am streaming that. Do you want me to hide that, or do you want anyone to reach out to you if they're interested in your product? Um, I can highlight it even if you want, but I don't want to. I don't want to hurt your privacy if you didn't realize that this is going to part of the stream here. Um, best viewed strawberry. Huh. Okay. I don't know what that is. I apologize. Okay. Whoops. Sorry, Lance. There. So the but yes, I do know that Lance does that, and I think it's fabulous. The okay, call me. Okay, yes. So anyone there who's interested in that in their product, give him a holler. Um, yeah. Now, other things, we talked a little bit about. Let's see. Oh yeah, I talked a little bit about younger people today. Mm, older people and cannabis. There's a lot more research coming out. I believe someone just posted an AARP article about it too. Everyone's becoming more and more aware that older people are using it. Okay. It's hard to summarize. It's okay. But there is a lot of older people who use cannabis these days. And the one of the things is we have to be a little bit careful of drug interactions. I actually have been asking people a lot about some of the different drug interactions out there. There are some databases that are coming out that people are starting to form. Cody gave me one. I'll post it on my page of one that is a nice little drug checker. Yes. The, but the, what was I going to say about that? Oh, but what's interesting is a lot of the data kind of comes out of the fact that cannabis, CBD, THC acts on the liver. So the metabolism of drugs, it either increases it or decreases it. And there's a lot of chemicals, cytokine P450s, or some of those. I don't know if it's a P450 or if it's a different one, but the liver has a lot of these chemicals that it uses to chemically break down things. It comes into our stomach, and then its job is to detoxify stuff. So if it's like, "Ooh, you might be a toxin," and it goes in and it actively starts to break it down. In fact, that's one of the reasons oral cannabis has a different effect than smoked, is because if you eat it, it goes into the liver. And actually, it breaks it down to a different cannabinoid that's still active. I believe it's the 11 version of it. And that then goes into our body and creates the high. And it's a slightly different high than when people take it inhaled. Because when you're inhaled, the lungs don't go through the liver. There's nothing from the lung. There's no, I mean, eventually it does kind of work through, but there's not this first pass. It's already hit your body by the time it reaches the liver again. In your stomach and your intestines, there's a thing called the portal vein that takes everything you digested and put it through the liver. So then all the carbohydrates, all the fats, all the toxins all get processed by the liver, and that's what your liver does. In fact, that's why when people have bad livers, they really start getting a little bit loopy because the toxins build up because they're not clearing the toxins from their food. Now, the what I was going to say about that is the chemical reactions it uses, it can be affected by the THC. So the THC might compete with it because the liver's working with the THC. It can't work with something else. Or it might stimulate actually another chemical to be made more that then breaks down other meds. Or it might inhibit a chemical. And so then a drug can build up in your body. And so there are some really profound ones out there that are like hmm, blood thinners. Warfarin is one. Thank God very few people are on warfarin anymore, but there are still people. That's a blood thinner. It's an old school blood thinner, and it pretty much interacts with everything under the sun. You breathe wrong. Literally, you take green vegetables or like leafy greens, a little extra spinach, and it can go through the roof. So the amount of warfarin, and it can go from being very healthy to very toxic very quick. And that's why people with, and so not surprising, warfarin interacts. Another drug that interacts, uh, hmm, so but a lot of things that they talk about interactions are really just this kind of up and down. In fact, at the conference, one of the things someone talked about was things like the antidepressants, that, yeah, it does raise the antidepressants level if you take, but it doesn't raise it to a dangerous level. You know, if you take Prozac 20 and the next dose up is 40, and you're taking 20, and now you take a little bit of cannabis, it probably raises it to the equivalent of 25. It's something you wanna talk with your doctor about, it's something you wanna be aware. This is one of the reasons you do wanna let your doctor know about cannabis so that they can say, "Hmm, that's not a good thing." Another thing that is questionable is, tacrolimus. That is a drug used to prevent rejection. Now, organ rejection, if you've had a transplant, that's life or death, right? That's not playing. And again, you need to have enough. Too much, you're at increased risk of infection, some which could be fatal. Too little, your body can, excuse me, reject that organ. Now, again, because you have that nice tight range, in that case, taking cannabis might increase it or lower it. And they say that if you really are taking it, if you really need it medically, you need to let your doctor know because they might need to measure that tacrolimus. Personally, I would think that if you have unless there is a really strong indication medically, super strong, I would not advise anyone taking tacrolimus with an organ transplant to take cannabis at all. Mm. It's the liver it's the liver that is yes, exactly. It it's the liver that's processing that effect. Exactly. The liver is an amazing organ. You It does so much for our body. It processes glucose. Interestingly enough, when we talk about some of the cannabinoids like THCA, THCV, a lot of them, there's a condition called fatty liver that happens because it's processing all this stuff, particularly in people who have diabetes or metabolic syndrome. We got the diabetes, the hypertension, the high cholesterol, and it all kind of goes together. Fatty liver is where you get fat depositions, fat builds up in the liver. And that fat buildup in the liver can actually cause damage so severe that it can cause liver failure. There are people who have developed cirrhosis, not from alcohol, but from fatty liver, and have died from that. Um, and so that is so the liver does a lot. And what's interesting is that there are a lot of studies that show that people uh, who have taken some of these, well, they're rat studies. I should stand corrected. They're not human studies. My mistake on that. They've done rat studies, models of fatty liver, and shown it's helped. Now, the THCV has done some studies on weight loss and stuff like that, and that might have some promise. But yeah, so fatty liver. And so that liver, again, very involved with, so. Mhm. By the way, a couple of weeks ago, someone asked about hypotension and interaction of hypertension medicines. And I think that's just something you have to be very, very careful about because some people can get hypotensive with cannabis. I was actually asked one of the experts about it when I was in at Puerto Rico, and they said that in their experience, it's usually right after you take it, especially if you take a higher dose, that some people can get very hypotensive. So, if you're taking hypertensive medicines, you wanna be careful, just, monitor it. You don't want to if your baseline low, again, there are medical conditions where the doctor actually wants your blood pressure as low as possible, people with bad hearts and stuff like that, that you actually need it as low as possible. And those are, again, situations where you really want to be weighing the risks and benefits and saying, maybe cannabis isn't for me. So that's that. So now, what has advanced more, cannabis or the human body? Oh, fun question. You know what? I actually heard someone say recently that they think the cannabis plant is a symbiont with us, much like you see some of the bumblebees or some of the insects that have co-evolved with the plants that they pollinate and stuff like that. I'm not sure if it's quite a symbiont in that sense. I mean, it does go back 10,000 years. You know, Egyptians used it, ancient Chinese. A lot of early humans used cannabis, but maybe it's a little bit more like the cat or the dog, where we did a lot of breeding and a lot of selective breeding for what we wanted and what we didn't want. But we did kind of grow up together and over time, much like the cat or the dog. And so coevolution, yes. I wouldn't quite call it a symbiotic relationship, but I do think that there's something to be said. You know, Alcohol is is perhaps the one thing that has beaten cannabis in terms of its universality. And that's partially because so many things can be fermented. Cannabis is one plant, well, three, but it's your three of different varieties, but and it's fairly global and grows in many different areas. But if it's not growing where you live, you don't have it. Whereas alcohol, if you don't have grapes growing where you live, you can make it from barley. And if you don't have barley, you can make it from rice. And if you don't have rice, you can make it from honey. So there's been many different ways over the centuries and different cultures that people have been able to make alcohol. And I think that's why alcohol is like the universal drug, even though it's not great for us, right? It has blended in our society. And then I think a step below that is cannabis. And I think cannabis for much of history has been either medicine or sometimes used in spiritual situations. I think I don't think people used it as recreational as we have been using it. This is because of prohibition, partially for sure. Right? I mean, the prohibition of cannabis is one of the strangest twisted stories out there. Not since, again, alcohol prohibition have we seen something. In fact, alcohol prohibition almost made sense because a lot more people die from alcohol poisoning, a lot more people die from alcoholism. Alcohol makes a lot of people violent. There is a lot of reasons that alcohol is not a great thing to drink, right? But cannabis isn't perfect. I talked at the beginning about some of the kids' issues, right? But then there are, and I've even touched onto chronic hyperemesis syndrome. We can talk about that again, at another point, because I think we're almost out of time. Wow, time's flew today. But the prohibition of cannabis was really more political than anything, right? It comes out in the 30s and in the wake of alcohol prohibition and stuff like that. Oh, yeah, let's ban cannabis. And for the entire 1800s, it was used as a medicine, for pain and for nausea and stuff. It was often little patent medicines, kind of like what we have right now. Things people are just kind of hoping it works. But what I mean by that is, you had little patent medicines, and then today we now have things that people can buy, but it's not like through the FDA, it's not through that. And you hope the person giving it to you is giving you proper stuff. But then you get into the 70s and you get Nixon. And Nixon, his people actually came out and said, we did this because Um, we knew that this would make our politicians, our political enemies angry, right? They did it because they specifically said the hippies and black people vote Democrat and we're Republican and we want to limit their right to vote and, punish them for not voting for us and whatnot. And one way they did that was by making cannabis illegal. because they said, "Oh, they also like cannabis. What do they have in common?" And so they made it strongly illegal during the Nixon era, strictly for a political move, but then kind of took a high and mighty, "Oh, drugs are bad." No, that's exactly diabolic policy for sure. Exactly, right? It was all politics, which is really annoying because you have something that medically can help people, and we are decades behind in research on this. Meanwhile, they're still debating whether it should be legal. It's still federally illegal, and there are still people in the politics who are like, "Ooh, we can't do that. It's bad." And it's like, "No, it's helping people." You know, and no one dies from cannabis though directly. Yeah, right? I mean, sure, you might get, some C there's some debate about, like, the CHS, some people might, the cannabis hyperemesis, and you hear stories about people who have psychosis who have done terrible things, but that is just generally, as a rule, when you look at the amount of people who have died from opioids, and I love my opioids for my hospice patients. I have prescribed more opioids than most doctors, but the cannabis, you know, cannabis doesn't do that. Cannabis doesn't stop your breathing like opioids do. Cannabis doesn't cause overdose deaths. We don't see the degree of people dying from cannabis. So the fact that it's Schedule 1 while opioids and cocaine are Schedule 2 is crazy, absolutely crazy, and it's just politics. Thank you, talk about it, right? I mean, there's a group called Americans for Safe Access out there. They are promoting to make cannabis in what's called Schedule 6. It's not actually um, less stuff. Folks die from choking more often, right? But it's an idea to make its own thing. They're adding at 6, not necessarily because it's going to be less restricted than 5, but because they want to give it its own category and say, this is 6. And so, and it would just be, this is how we're going to regulate cannabis. So, Americans for Safe Access, look it up. I would encourage you to talk to your congresspeople about it. Make sure that we get it. Also, I saw that meme too. That was hilarious. Cannabis tied with unicorn attacks for yeah, the number of cannabis deaths is the same as amount of unicorn deaths. The yeah, I mean, that's really kind of the craziness of it all again. It's political. There are, nothing's perfect. Nothing is perfect. Everything's going to have some problems. There are a lot of drugs I prescribe every day for a lot of different conditions, and some people have reactions to them. Some people don't do great. The same is true with cannabis. But the right? And but that's cannabis deaths and the unicorns are tied, yeah. Um Nothing's perfect, but this drug doesn't deserve to be where it's at. And we shouldn't have research tied up because of politics. And we shouldn't have research tied up into the endocannabinoid system. I've gone on in previous ones about how the endocannabinoid system, and we're going over, but I'm ranting a little here. I apologize. The endocannabinoids are so important in our body. If cannabis never existed, we'd have an endocannabinoid system still. The fact that we don't research it because, oh my god, it's related to cannabis, again, clutching the pearls, right? We need to be able to research stuff. A lot of the endocannabinoid system is tied to diabetes, it's tied to Alzheimer's, it's tied to a lot of the chronic illnesses we have. Meanwhile, we need to also be able to use cannabis to modulate it because right now it's one of the best drugs we have to modulate it. Mm. And so we need to be able to have access to all of those things. So, yeah, call your senator, call your congressman, someone, if you ever have a way of reaching Secretary Kennedy or President Trump, I'd love to give them a one-to-one education on the endocannabinoid system and why cannabis should be legal, why we should uh, pay for more research into the endocannabinoid system. That's my take on it. It is 4:05. I'm gonna be wrapping up for the day. It was great talking to you. Thank you guys again. Like I said, you guys are the co-stars of the show. And if you think a better time would be better, if you think more people might show up, then we need to um let me know if like a different time would be better for people because I realize that sometimes cannabis might be more a thing for not of safe for work for some people. Obviously, I see a lot of people who are commenting in are in the field, but other people, I don't know, they might not feel comfortable watching this during their work hours. You know, would later in the evening be better for people? Keep me posted. We might change it if that's the case. And let's do this. Yes. Okay, William. Yeah, give me a holler. There's actually some people I'm already talking to a little bit, but we got to figure out how to um, push things further. And let's do this. Okay, you guys, y'all have a great day. Enjoy yourself. Thank you much.